Good morning everyone. I am Dr. Sandeep Janardhan Tandil. I am a general and laparoscopic surgeon. As we are discussing the various swellings on our body, so today's topic we have selected is related to the scar. The scar, as you know, when any injury happens or post-surgery we develop a scar. So that's the swelling arising from the scar we have selected, and that is the name of that swelling is keloids and hypertrophic scar. So what are keloids, what is hypertrophic scar, how it forms, what is the reason for forming, the causes for it, then how patient presents, what are the how patient presents, how doctor diagnose it, and what are the investigations and the treatment related to it, we will discuss in a detail. So before going into the topic, the keloids and hypertrophic scar, how the scar forms or how the wound heals, wound is any injury, how the body heals, we will discuss in a short. So whenever injury happens or whenever a cut happens on our body, any part of our body, the first response of body is a bleeding, because bleeding, that is the blood comes out from that area. Our body is supplied by the blood all over the part so that it gets nutrition, and there are growth factors which helps in healing the body, natural healing of the body. So what happens when you get a cut? So first response is bleeding, the blood fills up that gap. I will explain simultaneously this condition with the a general condition. Like suppose we in a construction like a building or a bridge, when there is a crack happens, what we do to prevent further damage, we should fill the gaps or fill the cracks, or else the structure will become unstable. Similarly, our body responds whenever there is an injury, any part, body tries to heal it to protect the rest of the body from invasion of the bacteria, germs, or any further trauma, further increase in that. So like suppose there is a crack in a building or a bridge, we put cement, we put lot of the things which will hold the crack, or it prevents from further breaking. Similarly, the blood comes in the area, blood will fill that area, then blood will clot means it will become thick so that it will seal off. That is the first step. There are the 4 phases of the healing, and these phases goes over the months. So first step is bleeding. The blood once it seals that area, there are so many growth factors in the blood. There are so many cells which will come in that area to protect that part from getting infected. So what happens is there is addition and deletion, like the body will try to put things in that area, it will remove also. So this addition and deletion happens over the period of weeks and months. So the equilibrium means this addition deletion comes to an equilibrium by the 6 to 8 weeks after you get an injury. So by the 6 to 8 weeks it reaches an equilibrium. That means the addition deletion becomes to an equal level, and the wound strength, that time the wound strength is around 30 to 40%. Strength means when you consider a normal skin, suppose if you give it as 100% strength, the wound, when it happens by 6 to 8 weeks, the strength of that wound is around 30 to 40%. That is, it is not having the complete strength. So after what happens after 6 weeks is the body keeps on depositing a special things what it is called as a collagen. These collagens are like fibers. What I will say is like the iron rods or steel rods we put in a construction to keep the stability to the structure or the strength to the structure. Similarly, the collagen fibers body deposit. These collagen fibers will arrange in such a way so that it will keep on arranging, and it intermix with each other, like interweaving, so that it gives more strength to the wound. So over the period of the months, that wound becomes stronger and stronger, and the scar becomes flat. It becomes flat. It tries to achieve the normal color as the rest of the skin color, and it becomes little pliable. It might be little stretched also. So these are the way how the wound heals. Now when problem happens, like when this scar becomes ugly, doesn't heal properly, this is at this 6 to 8 weeks when the equilibrium happens. What happens is body keeps on adding. It doesn't delete. Delete means remove the things. When addition becomes more, the scar starts growing more. It becomes bigger and bigger. It start becoming increase in height. It will become thicker also. It will become reddish in color. It will give the different symptoms to the patient. So there are the 2 topics in this, which is called as a hypertrophic scar, hypertrophy, and other is a keloid. So we will discuss what is keloid and hypertrophy scar. So hope you understood how the scar forms. So what are the causes we will discuss about. So the causes for forming of this keloid or hypertrophy scar: any trauma to any part of the body. Trauma. So like most common example I will give you, that ear piercing. So when we do ear piercing, that's a type of a trauma to the body. Then this trauma can lead to the scars, hypertrophic scars or the keloid scars. With a foreign body. Foreign body means anything which is not from our body. So like we put this gold, or we put steel or metal, anything we put in the ear, that's like a foreign body. So not everybody reacts, but few people reacts to it, and the scar, it becomes thicker. It becomes ugly. That time it can form a hypertrophy scar or keloid. Another reason for is the infections. Infection, like some patients when they develop acne, the pimples on your face, or when they develop chicken pox, you can see the multiple scars and multiple ugly looking scars, which are called as the keloids or hypertrophic scars on their face or on their body. So these are the reasons. Then some people get a big scars on the chest area, this area. Some people are prone for it. Like there is also some genetic cause related to it. It runs in families sometimes. And now the patients who undergo the surgeries with opening in the middle, this area also people get multiple ugly looking scars or keloids, we say. So the reasons, as we discussed, can be trauma, infection, then even the skin tension. Like our body, the skin isn't relaxed. Relax means it is stretchable like elastic. Suppose you are wearing very tight clothes, it becomes uncomfortable for you. So same way the nature has made the body in a way the skin is stretchable. It is elastic, more flexible in some parts it is little less stretchable. So our body adjusts accordingly. So we have on our body, like skin is having lines which are called as the Langer's lines. If the cut happens along that lines, the body heals more natural way. If the cut happens opposite to them, then the skin healing is under tension, and that tension can also lead to formation of the hypertrophy scars or the keloids. So these are the few reasons which can cause the keloids or hypertrophy scars. Next we will discuss like in whom such scars are more common. If you see the data, the females are more having these problems compared to the males. One reason is that more ear piercing happens in the females, so they might have this more. Then age is like 10 to 30 years is the according to data says more prone for getting scars. Then now we will come to our topic of keloid and hypertrophic scar. So we will differentiate between them. What is keloid? It's a Greek term, keli. It's C-H-E-L-E. It's a Greek word which means the crab's claw. Crab claw. So the keli became the keloid because this like a crab claw, it goes in different direction. It doesn't remain in the same direction. So the term became as a keloid. Because keloid, the scar is little ugly. It doesn't remain in same line of the injury. It goes laterally. It may go up, down. Like it becomes irregular. So keloids are if you see, compare the hypertrophy scar and keloids. The keloids usually grow laterally. They may be more in height. And if the hypertrophic scar, if you compare, it's just growing, or scar becomes more thick in the same line of injury. Like if it is a single line, the hypertrophic scar means it is growing in same line. It doesn't go laterally. It doesn't spread laterally. Keloids will tend to spread laterally. It will go up, down, and it becomes very irregular. So how patient presents with these things? Most commonly, patient will be having some incident of injury. Some injury, like whether it is ear piercing, chicken pox, or any post-surgery problems. So post-surgery patient might come after the, as I told, this duration of 6 to 8 weeks, patient start developing the swelling in that area. Sometimes there is no complaint, it just look, that is a cosmetic purpose people come. because it is very ugly looking. If it is an exposed part, like suppose our neck or the face or the hands which are open, then you can see it, everybody can see it, and people feel bad about it. So that time people will go to the doctor saying that you want to know why it has happened or what will be the treatment for it. Other symptoms which people can have with this is itching. Some people can have itching in that area. The color might be it might be pink, it might be red, or it might be purple. Different colors might be there in that. If it is on the joint area, like your elbow or knee, suppose in that area, the movement might become restricted in that area. Such similar complaints patient will come out. Not all symptoms will be in every patient. Some symptoms will be present. So accordingly, when you go to doctor will ask you the questions related to it, like whether when it started, whether it started, the duration. He will ask the complaints, whether you have any itching, pain, whether the color change happened over it, whether it was infected, like post surgery or post ear piercing, whether it got infected. Similar questions doctor will ask you to know the etiology. Etiology means the reason for forming of the keloid. He will ask whether you have any family history of the keloids also. If doctor comes to diagnosis of hypertrophic scar, doctor might ask you to wait for 12 to 24 months. Sometimes hypertrophic scar can disappear over the period of 1 to 2 years. It may not completely disappear, it might decrease in size. But keloids mostly do not subside. They tend to remain like that. Sometimes they even grow in the size. And most common reason, as I told, patient visit a doctor because of the cosmetic reasons. So one thing I will suggest, if it is small, if it is not on your not exposed part, like our face or the hands, if it is not troubling you, if you try to remove it, there is a chance it might come back again if you have the tendency of forming of the keloid. So what investigations you might expect in if you have hypertrophic scar or the keloid? Ideally there are no investigations to confirm this. It is a clinical diagnosis. Doctor will look at it after checking, touching and asking you the questions. Doctor will come to diagnosis whether it is hypertrophic scar or the keloid. There is a Vancouver scar scale, Vancouver burn scar scale, which have the different points in it to categorize the scar. That we will discuss. I will show the photo of it. So Vancouver scar scale, this is the scale which doctor used to check the size of the scar, the color of the scar, and gives the point. This is also used post procedure, like post treatment, how the scar is responding, if it is decreasing or if it is increasing. So this helps in giving a general idea how the scar is responding to the treatment. So in this there are different points which shows pigmentation, vascularity, pliability and height. So whether it is normal color, it is more dark, less dark, it is pink, red or purple color, and how when you touch it, how it is, whether it is hard, firm. When the height will be measured according to the size, to less than 2 millimeter, up to 5 millimeter or more than 5 millimeter. So this is the scar scale which doctors use. But now the next question comes is what are the treatment options available for it? No single treatment option can be given to one patient, because one single treatment may not be helpful to the patient. So it's a different multiple approaches doctor might consider for you, and every patient will have a different approaches. Like one patient, if gets relief with one, you cannot say that all the other patients or his friends or colleagues will get same benefit with that. Everybody is different, and every person needs a different treatment. So your doctor needs to decide what type of treatment will suit you. So he will ask you whether what type of treatment you have taken in the past, how much it was effective, what was the cost for your keloid, and how much response you got. All these questions are important before starting a treatment. The standard treatment, what is preferred is occlusal dressing, compression dressings, and steroid injections. Other than that, there are a lot of other treatments also which doctors will discuss and decide accordingly. So what is occlusive dressing? Occlusive dressing means these are the gel pads which will be placed over the scar. This might be containing silicone or non-silicone gel pads. The aim is that it will hydrate, it will make your scar soft, and it might decrease in size. It might not completely disappear. Every patient will have different response. This has to be kept continuously like 24 hours a day for very long duration of time, and doctor will assess how you are responding to it. So the thing is, it will make the scar soft, and it might decrease. It might respond around 30 to 40%. Along with that, doctor will add another treatment also. So next treatment, which is compression. Compression is like putting pressure on that area. So putting pressure on that area helps some patients. Compression garments are available. If it is on the chest area, you might have to wear a little tight type of the compression garments which are available. It has to be kept like 24 hours same way. There should be continuous pressure over that area. If it is on other parts, there are different bandages, elastic bandages or wrapping type of bandages are available, which will be placed over that area. Now compression dressings along with another additional treatment will be followed. It's not like just doctor will give you compression dressing. So the third standard treatment is intralesional steroid injections. Intralesional means the scar, doctor will be injecting the steroid inside. The steroid commonly uses triamcinolone. So this steroid injection is given locally. Locally means in that scar over the period or over the intervals, I will say. Most doctors follow it like every monthly. They might give these injections along with compression or the silicone dressings, and see how you are responding. This treatment differs from for the most of the doctors. What we prefer is we give this steroid every 3 weeks, one injection over the period of 2 to 3 months. Then after that we see how you are responding. Then we might give another injection after 3 months interval, so that over the period of maybe 1 year or 1.5 years, we give these injections, and slowly the size of the scar, your itching, the redness will come down. So patient will have response over the period of time. It's not sudden response with this. So the benefit which you will get with this is your itching, the redness, the color change will happen. It will start becoming flat. The only thing is that once you stop treatment, there is a chance it might come back. That 100% nobody can guarantee you. So doctor might ask you to, after putting steroid injections, he will ask you to put some pressure dressings over there, so you get response for longer duration. Some patients get complete response, some patients may not get. Some patient might require another treatment sitting also. So as I told you, every patient have different healing capacities according to their body, and accordingly doctor need to take a decision to whether to repeat or whether not to repeat the treatment with you. Another combination treatment is surgical removal of the scar. Surgical removal, like entire scar will be removed, but just removing scar will not guarantee you that it will not come back. So doctor will give an additional treatment along with surgical removal, is giving the steroids on the in that wound area. After when the doctor will remove the stitches, doctor will start giving the steroid injections, same injection as we discussed, in surrounding that area, so that as we discussed, that addition deletion thing happens, anabolism and catabolism of the wound healing, so it remains in a control, and the scar formation, hypertrophic scar or the keloid formation doesn't happen. So this combination treatment of surgical excision with simultaneously giving steroid injections in that area is also an accepted treatment, which is followed by some doctors. According to the patient, it will be decided. What are the other treatment options available? There are also chemotherapeutic drugs which are being injected in other than steroids. Chemotherapeutic drugs are also injected, which also give similar response, like 5-fluorouracil. There are different chemotherapeutic drugs injections which can be given. Another treatment is cryotherapy. Cryotherapy is a liquid nitrogen which will be injected in this. Every treatment will have some associated problems, like when the liquid nitrogen is given post injecting of it, patient might have pain, the color might be little different, scar might decrease, but there might be color change. So cryotherapy, some patients prefer, some patients don't prefer, and it might be painful. Another combination treatment I will say is a laser along with steroid injections. Some doctors might prefer you to give the laser with specific frequency of the laser, and along with that they will give an intralesional steroid injections. Another combination treatment is post surgery, like you remove surgically the swelling and then radiotherapy, like light therapy. Radiation might be given to that area. That is also successful in some patients. There are steroid dressings, like bandages we apply when we have a cut, and similarly there are the steroid containing bandages that might be applied over the period of time. There is another cream available called imiquimod 5% cream that can also be used. Shown response to some patients, so that is also a part of treatment. There are lots of new techniques which are coming to through for the treatment of the keloid and hypertrophic scars. I will advise you that your doctor will decide which treatment might suit you according to your skin and according to your response to the previous treatment. So there are a lot of combination treatments, and keloid or hypertrophic scar might take time to respond. It might take few months to years to respond. So accordingly the doctor needs to take a decision for you. Hope you understood the keloid and hypertrophic scar, how it forms and what are the different treatment modalities available for that. One thing I would like to advise post surgery or after any injury, how to take care of scar is you avoid direct exposure to the sunlight, apply some sunscreen lotion over it, so as the scar skin is very sensitive to the light. Thank you for watching me and our videos. Thank you very much.